My name is Amer Safraz. I'm a consultant psychiatrist for the crisis team and Director of Medical Education, KMPT. Welcome to the new trainees. It's a huge trust really, and KMPT covers all Kent. On one side it stretches from Tunbridge Wells to Medway, and on the other from Swanley to Folkestone. Throughout Kent we have different hubs. Hubs meaning that inpatient and outpatient services are available alongside specialist services. These include adult psychiatry, old age, forensic services, learning disability services.
We've also got new consultants who specialize within exciting areas like neuropsychiatry. There's of course my post, which is a psychiatric intensive care unit, which is always quite fun on a day-to-day basis. And apart from all of this, we do have a range of services within rehabilitation psychiatry and specialist services like forensic psychiatry.
Hi, my name is Angela Pendleton. I'm the Medical Education Manager for Kent and Medway Social Care and Partnership Trust. We have 3 offices in medical education, one in Maidstone, one in Dartford and one in Canterbury. And our medical education team consists of 8 people. We provide assistance to all junior doctors with study leave, education and training. We run all the teaching programs. We're always here to help you with any problems you might have with your placement or with supervision or anything in general. Then you can contact any of the team members and we'll be only too happy to help you.
I'm Mohammed Siddiqui. I'm a GPST2 at the William Harvey Hospital, but I'll be doing my psychiatry rotation in Thanet, Margate. I am looking forward to learn new things because I need to do practical work, see the patients, work on them, make the decisions on treatment, working with the consultants, seniors, registrars. This is what I'm looking forward to.
My name is Joel Lawson and I'm a CT2 trainee, and I have spent the last year in 2 different rotations, an inpatient rotation and a community rotation. The first inpatient rotation was with the older adult service in Maidstone, being involved in the ward rounds and also reviewing patients for their physical and mental health and generally being part of a multidisciplinary team. And then I moved on to a general adult community rotation, doing my own clinics, but I had very good supervision with that from the consultant. It would be one-to-one supervision in that I would see the patient myself and then we would talk about a diagnosis and a management plan.
My name is Lucia and I'm a CT2 trainee in psychiatry. For the last 6 months I've been working in East Kent Rehabilitation Services. We were seeing patients on a daily basis in a ward round. Admitting patient was my other responsibility. Rehabilitation is a bit different from acute ward because the patients there are kind of like in a middle between the discharge from the acute ward to home. So we're working on how to live their everyday life after discharge.
My name's Ginny MacDonald. I'm just starting my ST5 training with KMPT. I have spent quite a lot of time with KMPT, having done my core training and now a year of higher training. I've spent the last year working in the community and so I have had my own clinics. I've been lucky enough to work with a consultant who was very clear about the direction that she wanted her team to take and was able to tell me exactly what she was looking for during the induction week or 2, and then very much stepped back and gave me responsibility for my own patients, but was always there available if I needed support. It's been interesting moving on to being a higher trainee from core training. I've realised that I'm now expected to have the major part of psychiatry in place and I'm being expected to extend myself out into other areas.
In last rotation, I was working in Thanet rotation, which means that I was covering only 2 wards of elderly psychiatric patients. The on-calls were not that busy, but it was again a fantastic opportunity to work with elderly people, either suffering from dementia or having the formal psychiatric diagnosis.
My on-calls were based in West Kent. By and large, I was doing mental health assessments. Occasionally I'd be phoned by the SHO or the crisis team or liaison for advice, but generally it was 136 work.
When I was in the community, the role was also liaising with the crisis team, the link between the community services and the inpatient admission. And the other role would be with the liaison team who work mainly in A&E. We always have good senior support, so the consultants are always on the end of a telephone or the registrar, and I've always found them to be very helpful and supportive, and they will come in if necessary.
The GP trainees have an exciting teaching program which they attend, which is specifically dedicated to psychiatry in addition to their usual sort of GP training program that they attend. Similarly, foundation trainees are offered excellent opportunities to participate in specific teaching programs tailored for non-psychiatry trainees. This is in addition to guest lectures, talks that are regularly put on for the benefit of all medics. We have a very vibrant academic program that runs within the trust across all the sites. So these include what we call journal clubs and case presentations. We also have simulation training within the trust where that offers an excellent opportunity for trainees to brush up their skills within psychiatric specialties.
We have a balance group, which is where we can bring challenging cases, and not just challenging in a clinical sense, but also if we found something difficult to deal with, then we can discuss that in a group, and it's a safe place to do that.
As a trainee in KSS, I had the wonderful opportunity to join a postgraduate certificate in Brighton University, and we have absolutely wonderful teaching over there. The modules and also the teaching is absolutely fantastic.
To book leave, you speak to your consultant, who's your supervisor, and then once you've got that approval, it's just a very simple form that medical education give you. You then contact the medical staffing team who will just check it against the on-call rota. If there are any problems, it's generally quite easy to swap on-calls with other trainees.
We like to support trainees with a lot of the resources that we have in-house, but also resources that we can draw from, both within Health Education England and within the trust itself. So all of that is available, so trainees will be listened to if they come to us with any concerns.
The last rotation I did, I really enjoyed. I think straight away I was brought into the team, and I worked with a range of professionals such as community psychiatric nurses, occupational therapists, consultants, support workers, and there was just a real team atmosphere. I felt they really valued and respected my opinions and thoughts on patients.
Any project in which I've wanted to be involved, I've had support from KMPT. I'm particularly interested in research, and I've watched a research environment being built pretty much from scratch, to be honest, over the last 4 years. We now have support in statistics, we have support from a Professor Emeritus, and really we couldn't ask for more.
As a GP trainee, I would benefit from this rotation because I think I'll be seeing a lot of patients with psychiatric illnesses. I will know how to treat the patients in a community setup or at the GP surgery and where to properly refer them.
I have to say that psychiatry is a brilliant specialty, and you not only use your medical skills from the medical school, not only your physical health skills, but also you develop new things, talking to patients, having a good rapport and relationship with patients, and also include family. I feel that psychiatry is a proper holistic approach.
I am responsible for the delivery of education and training for all level of trainees in this trust, and we take a lot of pride, me and my team, in doing so, because we feel that this is a huge investment we're doing in their future, and once they go away from us, they not only take away the skills and the knowledge they get, but also how they apply it going forward for the betterment of their patients.